Okay, so I think we'll get started. It's 11:02. So I'm Susan. I'll be moderating the session, and Dina will be taking over in a moment. So thank you for joining us today for our Going Outside of the Home COVID-19 Considerations, which is the third webinar in the series Staying Safe with Dementia in 2020, New Realities. So before we begin, let's go through a few guidelines for the presentation. So we are using Zoom to present this webinar. And this technology is great. It helps us to connect with you securely. And we believe that privacy measures put in place by Zoom will protect your privacy. However, we urge you to take steps to protect your own privacy by using secure Wi-Fi and using only your first name. The sign-in link, which was provided to you, is specific to this live webinar. So please do not share it with others, as everyone needs to have registered in order to participate. So the presentation portion of this webinar is being recorded and will be archived for future viewing. In Zoom's webinar platform, your cameras and microphones are not activated. So next slide. Great. So during the presentation, if you have any questions for the presenter, Justina, please type them into the Q&A box. So you should see the Q&A icon at the bottom of your screen on the right. We will respond to questions at the end of the presentation. If you are having any technical difficulties or can't hear the presenter, or if you're having any issues like that, please use the chat box. So you will see this icon on the left. We are not using the raise hand feature today. So once the presentation is complete, we will stop recording so questions can be answered. So please note that we will be providing general educational information and not offering specific advice for your unique situations. Please direct these questions directly to your support worker. So enjoy the presentation.
Thank you, Susan. Hi, everyone. My name is Dina Boone. I am the Public Education Coordinator for the Alzheimer's Society London and Middlesex. Before I begin, I just would like to mention that the information being presented today is current as of today. Many reputable websites have been researched for accuracy, and since our current pandemic situation is a moving target and changes are happening daily, it is important to check resources on a regular basis. You will also note in the presentation some small numbers next to some information. These numbers are specific resource links that you will see at the end of the presentation for easy access and reference. Let's begin the presentation. So some of the topics that I'm going to cover today are: what are essential and non-essential services or actions? A breakdown of some of the essential services available within our community. Things to remember if you leave your home, and planning ahead. So here are a list of some of the essential services in Ontario. Food and health, including for animals. Transportation. Finances. Information and communication technologies. Safety. Energy and utilities. Water. Government services. And manufacturing. So what do retail services include? Food services, such as grocery stores and specialty food stores with items such as the Covenant Garden Market or the Healthy Planet. Restaurants and other food services that prepare takeout, as well as Fresh Food Box and HelloFresh organizations. Pharmacy, hardware, office supplies, such as Staples, the LCBO, our health services. There's a lot of confusion right now for people regarding the hospitals and whether they are safe. So is it safe to go to the emergency department? Yes, absolutely. Any patients who have suspected COVID-19 virus are separated from other patients, and other protocols have been put into place for safety for the staff, physician, and patients. Is it okay to go to the urgent care center at St. Joseph's Hospital? Yes, absolutely. Safety measures have also been put into place for patients. You'll be asked to wear a mask upon arrival for the duration of your visit. Please do not bring your own mask, as they would prefer to provide you with one for hygienic reasons. And do not wear any gloves. Preference is for you to use the alcohol-based sanitization at the entrances. So where should someone go if they think they have COVID-19 symptoms? Please go to one of the following London Community Assessment Centers. One is located at the Carling Heights Optimus Community Center on Elizabeth Street. The other is located at the Oak Ridge Arena on Valletta Street. And there is also an assessment form online for people who live in the county and for London as well on the Health Unit website. Health services for our animals. The London Animal Services will only respond to reports of any stray dogs, bite investigations, and sick and injured wildlife. The Ontario Veterinarian Medical Association has provided a numerous number of guidelines for veterinarians across Ontario. Each clinic will vary depending on their current situation. Some of the examples of services that might be available are food sales, heartworm and flea tick prevention, where it's the season where many people will get medication for their animals. If you are an existing client, medications may be able to be dispensed without testing. Vaccinations may also be completed depending on your own personal situation with your animal. It's important to check out the guidelines listed on the website, as well as contacting your own veterinarian services to see what services they are providing. There have been some common questions that the London Police Services have identified. Some of the questions are as follows. If I have an emergency not related to COVID-19, can I still call 911? Yes, all emergency services are still in place. Can I go to the police headquarters if I need to? No. As of March 31st, the London Police headquarters are closed. However, if you have urgent items such as house keys or wallets that need to be picked up, the Property Control Department will remain available. You will be asked to report to the outside of the front doors of the headquarters and speak with an officer through an intercom service located outside of the police headquarters. Is the Collision Reporting Center still open? Yes. A screening process has been put into place to protect you and the staff working. If you are not feeling well, please do not go. What do you do if someone shows up at your door or calls asking for donations related to COVID-19? Since we are all practicing physical distancing, it may just be a good idea not to answer the door at all, and to report any incidences to the London Police Service. If you feel that you have been taken advantage of, please call the London Police Fraud Intake Line at 519-661-5515. But please do not call the 911 emergency line. For those listening outside of the London area, please contact your local police services department. How do you report people violating the COVID-19 restrictions? for people violating the COVID-19 restrictions. Please call the City of London at 519-661-4660 or email covidorderconcerns@london.ca. If you live in the county, please call the OPP non-emergency line at 1-888-310-1122. If you live in the Strathroy area, please call the Strathroy Police at 519-245-1250. The London Fire Department has put a ban on open air burning, such as fire pits. This is just temporary to help keep resources readily available should there be a need. As mentioned, the London Police Headquarters office is closed, but still accessible. The Middlesex London Paramedic Services is operating 24/7 as usual with COVID-19 screening precautions and protective equipment. Services available for London's most vulnerable. Many services and washroom facilities have been closed. However, comfort stations have been implemented at the Victoria Park. There is also a support for basic needs list on the City of London website, which will list all social assistance, housing, homeless prevention supports available for the vulnerable within our community. Essential transportation services. The LTC is encouraging people to only take transit when it is absolutely necessary. The provincial order of 5 people limit per public gathering does not apply to transit. So when riding the transit system, please practice physical distancing as best as possible. Extra buses will be sent out if needed. The LTC is asking riders to board the bus from the rear doors. There are also sensors located at the rear doors for automatic opening and closing. Riders with accessibility needs can continue to use the front doors. Service routes for the LTC have changed, so please check the schedules. The service demand and routes, the routes will depend on the service demand being requested currently. The LTC is ensuring that all vehicles are thoroughly cleaned and disinfected on a nightly basis. Please do not go to any LTC locations. Should you have any questions, you are welcome to call 519-451-1340 or check their website for further details and updates. Specialized paratransit services are still operating during COVID-19. They operate within the City of London boundaries and have level of service. Their level of service varies depending according to the time of day. Since the specialized paratransit service is part of the LTC, the same precautions are in place for COVID-19. Meals on Wheels transportation services has stopped at this time. The age-friendly network has various transportation options also available and listed on the website. So if you check the City of London website, you'll find various transportations available within London and the surrounding area. VON is offering transportation services in the Middlesex County, bus and van transportation for essential medical appointments. They are limiting the number of passengers on each trip. And appropriate screening and disinfecting practices are also in place. (211) Ontario. What is this? 211 Ontario is a community and social services helpline, which helps people find programs and services within their community. You're welcome to call 211 or the 1-800 number for emergencies directly, or you can check their website. Once on their site, you will select a topic of interest, such as transportation, and put in your city location, and the system will automatically populate some options available within your community. For example, in London, here are some of the options that are available within our community. Technology services. Communication and internet providers are maintaining services with COVID-19 precautions in place. Should you have an issue with any communication or internet problem, service calls may take a little bit longer than normal, so please be patient. Some providers are also offering extra services or free services. Some of these examples are as follows. Waiving of extra usage fees for residential internet customers. Waiving long distance charges for home phone for calls in Canada. Free access to some popular channels automatically. Roaming fees are being waived. Free previews of several Canadian and international news channels. And flexible payment options for clients facing financial challenges are also available. So again, please contact your specific provider to find out what services are being offered for you at this time. Energy, utilities, and water services. London Hydro has enhanced their online services for easier access. Any clients that are experiencing financial challenges can make extended payment arrangements. Water operations services are still happening along with repairs. Should you have any water emergencies, please call the City of London at 519-661-2489. If you live in the county, please check with your specific providers accordingly. Government services. Many Service Ontario centres are closed. However, many expiry dates for the following items have been extended until June 30th. Driver's licenses, health cards, photo cards, license plate stickers, accessible parking permits, and many more. Many of these services can also be completed online. Please check the Service Ontario website for further details and updates. Non-essential services and actions. Things to avoid. Malls and shopping centers are closed. Hugging or shaking hands. This refers generally to people outside of your household, unless of course there is someone who is sick in your household. Crowds or gatherings. Visiting friends. Sharing food or utensils. Participating in group activities. Visiting popular destinations, and parties or any other social gatherings. So should you need to leave your home, please remember the following. Limit trips to the grocery store or pharmacy to once a week. You can call ahead to place your order and arrange for curbside pickup. If you have a person with dementia with you, this will make things a lot easier for you as well. Using the tap feature or credit card for payment as much as possible to avoid handling cash. Bank during non-busy times or use the online services that are available. However, there are some people that do not use online services. You can also contact your bank directly and ask them to provide information for you over the phone. I've been doing this with my mom, actually. If using public transit, limit your trips and travel during less busy times as well. And if you have a pet, always use a leash and maintain social distancing. When you're out and about and you happen to see friends or neighbors, just greet them with a smile and wave from a distance. Limit the number of people on an elevator if you live in a building, as per your building guidelines. Some of the things that you also can consider is perhaps facing in the opposite direction of others who are on the elevator with you, trying to limit the point of contact with your hands, perhaps using an elbow or your sleeve. Always carry alcohol-based hand sanitizer with you so that in the event you do need to touch various items, you can clean your hands thoroughly as much as possible. Always wash your hands and use sanitizer when entering a building, exiting a building, and when you return home. So planning ahead. If you have any medications that need to be renewed, please call your physician or pharmacy ahead of time so that there's no delay in you receiving your medications. Again, arrangements can be made for curbside pickup, and I also know that some pharmacies also have drive-through options available as well, which is very handy. When you're filling in prescriptions, try to go to the pharmacy during less busy times. Stock up on essential items for your home to avoid panic buying. There's also a really important form in the event there's an emergency that you should fill out. It is called the Ready, Set, Plan for Care Partner Absence form. You'll find this form on the Alzheimer's Society London and Middlesex website in the Care Partner corner. The form has some really good information. It refers to care partner information related to power of attorney and personal care, information for the person with dementia regarding health, medications, assisted devices they may be using, everyday activities, financial information, specific symptoms the person with dementia may be experiencing, such as finding words, difficulty concentrating, feeling anxious. There's also a booklet entitled All About Me, which can also be found on the Alzheimer's Society website, which could also be very helpful. Please contact your support worker for any specific questions you may have about this form, or if you are having trouble accessing. This form would be extremely helpful in the event yourself or the person with dementia has an emergency and needs to go to the hospital. Please talk to family members and friends about your plan and let them know that you have filled this out. Make sure the plan is easily accessible and visible. So I have the next couple of slides are actually just some really good visuals. I know I've covered this material, but I thought it was worth sharing. This visual actually came from the Government of Canada website about physical distancing. And this one I really liked, and this is from the Health Unit website, and I just thought it was a really good visual with the colors, and it's very specific about things that we should avoid, things to be cautious about, and things that are safe to do. The next webinar in our series is entitled Communicating Effectively, and we will be having a guest speaker, Dr. J.B. Orange. He is a professor from the Faculty of Health Sciences at Western University. The session will be held next Friday, May the 8th at 11 a.m. To register, please go to the ASLM website in the Education Zone. So here are the resources that I have referenced during the presentation, and you'll notice all the little numbers that are attached to that. So hopefully this is a lot easier for people to reference if they want to explore the sites further. And also here are some additional resources and sites that I went on to capture information for this presentation. All these resources will also be posted with the presentation as well. Thank you so much for watching. And if you have any questions for me, feel free to ask them at the end of the presentation, as Susan mentioned, or you are also welcome to email me directly at dinaboone@alzheimerlondon.ca. Thank you for watching, and have a wonderful day.